Hi everyone, and welcome to another live Save Tool video. This is the first video in the Nutrition Modeling in LiST video series, and in this video we're going to learn a little bit about how LiST handles nutrition more generally in the LiST software. So in LiST we have some pregnancy interventions that have direct impact on stillbirths, as well as some other ones that go through birth outcomes, which will affect stunting rates, which will affect either neonatal or child mortality. We have some childhood interventions that go through age-appropriate feeding practices and or dietary adequacy, which in turn will affect stunting and wasting rates, will reduce them, and that will in turn have an effect on child mortality. So in LiST, we're focusing really on child, neonatal, and stillbirth mortality. So in 2012, and during one of the World Health Assembly, or the 2012 World Health Assembly, countries got together and established these global targets for nutrition. And they agreed similarly to the MDGs. They agreed that this time for 2025, each country would try to reach these targets. And so these 6 targets are centered first on stunting. So we're aiming for a 40% reduction of the number of children under 5 who are stunted. The second target focuses on anemia, so 50% reduction of anemia in women of reproductive age, so not focusing exclusively on pregnant women, but really targeting all women of reproductive age. Our third target is a 30% reduction in low birth weight. Our fourth target focuses on not having any increase on childhood overweight rates or obesity. Our fifth target is focusing on breastfeeding, so it aims to increase the rate of exclusive breastfeeding in the first 6 months up to at least 50%. And lastly, the last goal focuses on reducing and maintaining childhood wasting to less than 5%. So this is what the global community agreed upon. And in LiST, we actually have a way to model 5 out of the 6 outcomes. So we can model stunting, we can model maternal anemia, we can model birth outcomes. In LiST, they're separated out in small for gestational age and preterm, which together make up low birth weight. We can also model breastfeeding behavior, which should be ideally early, exclusive, and continued. And we can also model wasting. Something that's not in the WHO targets, but that we can still model in LiST is the diarrhea incidence. One last note, at the moment, LiST does not include any interventions that have impact on childhood overweight. Perhaps in the future, but at the present time, that is not included. So just to bring us back, because we are speaking about nutrition right in this video, nutrition interventions are typically split up into nutrition-sensitive and nutrition-specific interventions. So the nutrition-specific interventions really touch upon the immediate determinants of fetal and child nutrition and development. So kind of the very proximate causes are being targeted by these interventions. Nutrition-sensitive interventions are more upstream. They're bigger picture, further removed from the immediate determinants, and rather they address the underlying determinants of fetal nutrition and development. So we're talking about adequate caregiving resources at maternal level, household level, community level, access to health service. So kind of the bigger picture things, not quite so immediate. So to give some examples, in terms of nutrition-specific interventions, we can look at treatment for severe and moderate acute malnutrition, infant and young child practices, for example, breastfeeding, oral rehydration salts. So really these kind of very immediate interventions. Nutrition sensitive interventions, like I mentioned, are bigger picture. So we're talking about general indicators that are around women's empowerment, early child development, social safety nets, kind of all of the bigger picture structure that we need to be able to support advancing the nutritional status of a population. However, these things are a little bit more difficult to model and to get an effectiveness value for at this point in the literature. So for now, LiST mostly focuses on the nutrition-specific interventions, so the ones that are on the left. And just so that you have an idea of what's actually in LiST right now, we have some peri-conceptual interventions. So those are the folic acid supplementation fortification and blanket iron supplementation and fortification. We have some pregnancy interventions as well, or some interventions delivered during pregnancy, such as calcium supplementation, micronutrient supplementation, either multiple micronutrient or just folic acid, iron as well. We have balanced energy supplementation during pregnancy. Some preventive interventions we have will be breastfeeding promotions, complementary feeding, either just the education or the education and the supplementation. We have the vitamin A and zinc supplementation as well. And in terms of curative interventions, we have zinc for the treatment of diarrhea, vitamin A for the treatment of measles, and then SAM and MAM for addressing wasting. And finally, just so that you can kind of get an idea of how complex nutrition is in LiST, it gets even more complex if you think about it outside of the health system and think of all the other nutrition sensitive interventions that could be added onto here. But just looking at these immediate factors, a lot of things have an effect on malnutrition in LiST.